Okay, welcome then everyone to this session supporting citizenship reviews. This is part one of two parts. So in this 60-minute session, we'll introduce the concepts of searching the healthcare literature to support citizenship reviews, from the initial framing of a question to demonstrating a search using the PICO framework, searching for both keywords and subject terms for CINAHL and MEDLINE. And it is on the new EBSCOhost interface. For those of you still using the classic interface, you've not yet migrated to the new platform, we do have previous recordings from earlier sessions available on our YouTube channel, but we are looking at the new interface today. And part two will cover the processing of search results and including exporting to bibliographic software and so on. So to formally introduce myself, for those who've not met me before, attended one of my webinars, I'm Richard Crooks. I work for the EBSCO customer training service team based here in the UK. So I'm a senior customer training specialist for UK, Ireland and the Nordics, and also chartered librarian by profession, having spent 12 years as a medical librarian or related roles in the NHS in England. So 14 years now with EBSCO. So glad you could join this session today. Welcome from wherever you're hailing from, as it were, this morning. So in terms of the session then, in terms of the objectives for today's webinar, I hope that by the end of the session, you'll be able to describe the key steps in searching in supporting of a citizenship review. And I'm sure many of you are already familiar with that, and you've been doing this for a number of years. Perhaps others may be less familiar. But just to recap really on what we're looking at today. Also, you'll be able to plan an appropriate search strategy using the PICO framework. We've now added the time element, the T there, so it could be PICOT, as it were, for the framework. And this again is on the new EBSCOhost interface. You'll be able to also locate and use the available methodological search filters. Again, there are a number to show from both CINAHL and MEDLINE, and you'll be able to find further support for EBSCOhost research databases, in particular in relation to the new interface, which has been developed and is now live for many. So in terms of the actual context, then we are, of course, looking at systematic reviews. We won't get into the appraisal side of things, but basically, obviously, we're looking at a systematic review, which is a review of a clearly formulated question that uses systematic and explicit methods to identify, select, and critically appraise relevant research, and to collect and analyze data from the studies that are included in the review. So I've highlighted the key things here that we're going to focus on in this part one, that is the clearly formulated question, and also the systematic and explicit methods to identify the research that's out there. So typically, of course, with this, we are endeavoring to identify all studies, or you could say the majority of studies that could meet the eligibility criteria. There's some debate whether you'll find everything, but the best intention is to find what's out there on a given topic in relation to a specific question, which we'll look at this morning. So with that in view, we have, of course, the key points regarding the search steps, and we are looking at identifying what's out there essentially. So the first thing that we'll do is, of course, understand the research question. We need to know what is the research question, what are we looking at? And then, of course, we need to turn the question into a viable search strategy. And that will be using a combination of keywords or free text searching, and also the use of the control vocabularies, the subject headings. So for MEDLINE, it's MESH, medical subject headings. For CINAHL, you have CINAHL headings. And of course, you may have other databases like API PsycInfo, whereby you'll use the API thesaurus, and there'll be other databases with different indexing as well. So we'll look at a combination of keyword searching combined with the subject terms, and then also the application of truncation, wildcards, and proximity searching to enhance the information retrieval, to expand the search, to increase the likelihood of finding what's out there. And of course, we'll need to report on that later as well. So that's what we'll be going through this morning in this particular session. So we do have a particular research question, and you can see that there now in the PowerPoint. In adult cancer patients experiencing fatigue, what is the effect of meditation compared with standard care on quality of life within 6 months? And already you can see I've applied the PICO element to this question. I've highlighted the key terms, so adult cancer patients experiencing fatigue. So this will be the population group, as it were, the patient. What is the effect of meditation? That is the intervention we're looking at specifically for these cancer patients who have fatigue. Compared with standard care, that will be the comparison. And of course, the outcome of that is the quality of life. What impact is it having on the quality of life? And then there's a time frame within 6 months as well. So that kind of nicely fits the PICO structure. But to give it more flesh, as it were, I want to just move on to the next slide quickly. And you'll note in this particular framework, not all these elements are going to be searched for directly. So I mentioned at the outset, we've got patient population, we've got adult cancer patients, so we know the adults. They've got cancer and also the experience in fatigue. Meditation is the intervention I've mentioned. Obviously, it's compared to standard care. Quality of life is the outcome we're looking at. And then within a period of 6 months. Now, the second row there that you see is where we begin to collate or consider what terms we're going to use to search the databases. So whether using CINAHL or MEDLINE, starting off with one and then moving on to the other. It's unlikely that we'll be cross-searching them simultaneously, simply because in this context of a systematic review, we're going to go in depth, use the vocabularies, and they won't always relate to one another. So we are searching the database individually. So you may start MEDLINE, you may start with CINAHL, but you may search both ultimately. So you've got cancer, you've got neoplasms, oncology, tumor, etc. Also alternate spelling as well, malignancy. And of course, since these patients also have experience in fatigue, we've got fatigue, tiredness, lethargy, etc. So these in italics there, these lowercase terms are the synonyms that we could be using so that we'll be enter them as keyword search terms or free text search terms, and largely considering what do researchers use, what do the clinicians use, what are the standard references to these kind of elements for the problem, the patient, etc., the condition. Then there's the intervention, meditation, of course, a key word. There's also mindfulness. You have mindfulness therapy. You've got breathing techniques, relaxation techniques. You've got yoga, maybe guided imagery. So they're kind of variations of this. Comparison, not really needed as a search term, because it goes without saying almost that if we're looking at these other interventions, they will be compared in all likelihood to standard care. Okay. Outcome, of course, quality of life, or QOL, quality of living, life quality, well-being, and that can be rendered in different ways. By the way, I've got well-being with a hyphen there. When you're searching the EBSCOhost platform, the hyphens are not considered. So you don't need to enter a hyphen for a phrase like well-being, for example, or a term like well-being. And then type of study will not search that directly as a search term. So the third row that we've got there in uppercase, as you might guess, relate to the subject headings. So for MEDLINE, mesh terms for center headings, other databases, again, like APA, PsycInfo would be the APA thesaurus terms. So you've got neoplasms, fatigue, exertion. You've got, for intervention, meditation, yoga, relaxation techniques is a subject term, quality of life. And I think that's both true of CINAHL and MEDLINE. Now, the subject indexes will differ between the two, although mesh terms, center headings both originate with the National Library of Medicine because of the nature of the databases. So CINAHL being nursing and allied health primarily, and MEDLINE being biomedical with some nursing content, etc. There are going to be some different emphases. Some terms will be the same, others will differ, etc. But again, we are looking at the standard way of approaching it, which is searching the database individually, although they can be cross-searched if necessary. But that would be more related to keyword searching than using the index terms, which again might not compute between the two databases. So this just gives us a framework, and obviously there's a caveat to this, because typically you won't know what the subject terms are initially unless you have a lot of experience of searching this topic and you're well aware that, for example, relaxation techniques is the default subject heading for relaxation, etc. So again, that's something you would find out through various iterations of your searching. When you found relevant records initially, you might explore additional subject headings. And I know at least one place where they prefer to start with the subject index term first, because that will then also give them clues to what keywords should be searched for. So again, you may do it in any order. I am going to do it in a specific order just for the sake of this session, for the sake of the demonstration. But again, you may have different approaches to this specifically. So just that's kind of the background to this. I just want to also clarify then the approaches we take on the new platform. So there's some debate regarding in supporting a systematic review, for example, whether you're going to do just a general unqualified search or whether you're going to be more focused, for example, with a title and abstract search. If you go by the approach of an unqualified search, you are essentially searching all fields within the database. Now, that's highlighted in the drop-down menu from the screenshot here. But when we say all fields, what we really mean is the default fields for an unqualified search for a specific database. So if you're searching CINAHL as a keyword search, then when you search for a term, for example, like diabetes type 2, it's going to search for those terms appearing, whether they appear in the title, abstract, the subject headings, and that's where it's word index, not the exact heading, PubMed ID if appropriate, and DOI if appropriate, and then author fields. So by default, when you do a keyword or free text search, an unqualified search within CINAHL, it's searching specifically within those fields. Okay, so it will retrieve results accordingly. If the term or terms you enter appear in any one of those fields, it will retrieve a record based on that. MEDLINE, on the other hand, has additional fields. You can see some there like the author affiliation there, personal name, transliterated title, contributed indexing as well. So database will differ, okay, in how they retrieve records. But again, the principle is searching by keyword free text, not qualifying it by a field code such as TI for title or AB for abstract or MH for a exact heading that you'd find in CINAHL or MEDLINE. Now, if you want further information on this, and certainly if you want information related to other EBSCOhost databases, we do have the EBSCO databases help files available. These were the original help files available in the classic interface. They've been archived and made available through EBSCO Connect. So you can explore the specific database help file. So for example, we're looking at CINAHL, the basic abstract and index only version today. But if you subscribe to CINAHL Ultimate, for example, or MEDLINE Complete, there are specific help files for those databases available. Essentially though, when we're searching the databases, regardless of the content coverage, the way of searching is the same. Now, with that in view, if you are ones who search like unqualified keyword searching and then you're going to combine it with your subject headings, what you need to be aware of are the search modes and expanders. So essentially, search modes define how they're going to have what the search experience is for the user, essentially. So these are search within search options. By default, I would say in most cases, I know there are cases where this is not the case, not the same. The search mode for EBSCOhost is proximity. Okay, that's the default label and the default method of searching. So when you search by proximity, what you're really doing in most cases, and by default, is searching for terms as they appear near each other within 5 words or less. So for example, childhood near 5 words, N5 obesity means you find childhood within 5 words less of obesity, or obesity within 5 words less of childhood. You won't see the operator detailed, you just put childhood obesity. If the proximity search mode is selected, if it's not been changed from the original default, it will search in that way. Now, it is possible to reconfigure proximity search mode. So, for example, in the English National Health Service, they have made that W0 within 0. So, in other words, if you put in childhood obesity, it's searching for words in that order where they are near each other or next to each other as a phrase. Okay, so now some might have find all my search terms, which means it's and. So again, using the same example, it'll be childhood and obesity. So both terms would appear somewhere within the reference. Okay, find any is simply or. So there are these search modes, and that will obviously impact the retrieval of information when you do an unqualified search. Okay, we have more information on that, as you see in the PowerPoint, so you can explore that in your own time. But just wanted to highlight that initially. So again, there's also within the database itself the context-sensitive help menu, which will take you to the appropriate page to define or describe each search mode. So again, this is really only in relation to when you are doing an unqualified search, which you might then combine with the subject search. The other aspect of this, the other feature of this is use of expanders. So again, this is where your results, your keyword search results will be expanded beyond the search mode function to then begin to consider other options. For example, apply rated words would look for synonyms, alternate terms within the thesaurus. So within MEDLINE, it would be the mesh index. Within CINAHL headings, etc. So apply rated words looks for synonyms rated to your term that are there and plurals that are available. For example, if you put in child, it may pick up children from the index. Okay, and that's an index term. Likewise, also then you've got also search from the full text. So that's going to go beyond the default field searching that we mentioned earlier to search within the body of a document, be it a full text book chapter, an online full text article, PDF article, etc. So again, that's going to increase the likelihood of your hits. And to let you know also, to reassure you that if you do approach the search in this way as an unqualified search, with the search mode accounted for and expanders, they will be detailed in the search history now. Okay, you will see those. So if you need to report on that, as you ultimately need to do in supporting review, you can verify how it's been expanded in terms of what's been applied to it. And then apply subjects is simply mapping your keyword search term to a concept. So for example, you put in workplace injuries, it might map to the concept of occupational injuries. and that in turn will then identify the relevant index term. Okay, so apply keyword subjects maps your keyword search to a concept. That in turn will then retrieve index terms that have been associated with that concept. Okay, so again, there's a little note there to say this is applicable to unqualified searches, and they will appear in the search result list as being enabled. Now, of course, they can be disabled as well. They can be hidden behind the scenes or just disabled when you begin searching. Now, to go in a more focused way, then you've got the alternative, which perhaps most of you are approaching it from. That is the title abstract searching. Now, we do have, as some of you are probably aware now, since we've been running these sessions for a few months, or at least related sessions on CINAHL MEDLINE, we have launched or introduced a title abstract search fill code, XB. So that will search for your terms when they appear in either both fields or any of those fields. Okay, so I know for years, having worked for EBSCO now for 14 years, we often got comments about other platforms searching title abstract simultaneously. It's now possible to do that with this fill code. Okay, so I have included a help sheet link in the PowerPoint to explain that further, but this is just where you're being more focused. So if you're going to combine a title abstract search with the subject search, then it's possible to do that. So again, this is an example from MEDLINE there, and the drop down would be also the same for CINAHL as well. So title abstract XB is a title abstract search. Okay, so you can either enter your keyword search terms. For example, this one is heart attack or myocardial infarction or cardiac arrest, and select the drop down menu fill code, or you can enter it as a command line. So you can prefix the search string with the fill code XB, and it will generate the same results. So again, this will then override the default search mode, etc. Okay, but again, it will be recorded and noted in the search history, as we'll see live in due course. So just some background there to the searching, whether you're doing an unqualified search initially as a keyword search and then or title abstract. Now, for each of those elements, you may want to also enhance the search to find all stages that meet the eligibility criteria by considering incorporating truncation wildcards on EBSCOhost. So you see some examples here. Some of you may be familiar with this already. Truncation is the asterisk, the star, and that can be used to truncate words. So for example, diabetes for diabetic, etc. Or you can enter the asterisk between terms to find multiple expressions. So using ventilator asterisk pneumonia, we'll pick up ventilator pneumonia, ventilator acquired pneumonia, and ventilator associated pneumonia. If you want to form an exact phrase, then use double quotation marks. So if you're looking for influenza vaccine, just use the quotation marks there, the double quotation marks. You can also replace single characters with wildcard, the question mark. So if you're looking for women or woman, then rather than typing both terms, you can just insert the question mark there for the A or the E. Likewise, if you're looking at cost-benefit analysis or analyses, or another one, psychoses, then you can replace the appropriate vowel with the question mark to find both variations. We also support alternate spelling with the use of the hash wildcard, so used for pediatrics, color, behavior, and so on. So for pediatrics, you put the hash before the E, P hash E, that'll find both variations. For color, it's O hash R. And then likewise for behavior, it's I O hash R. Okay. So again, there are variations that you can use there. So we do have more information on these elements in the on the EBSCO Connect site if you need more information on any of these as well. And I think I've included a link to such documentation also post-session. Now, also in terms of enhancing the search, enhance the amount of information you retrieve, we've also got the proximity precision searching. So we've got this in terms of how you can incorporate it in a more command line fashion. So we talked about proximity as a search mode for an unqualified search. Now we're looking at the use of operators near and within the search string itself. N is the near operator. Again, by default, it's near, which is used for the proximity search mode. It can be used when you're entering your search terms line by line, as it were, and near will search for words regardless of the order. So using gallbladder disease, then you could put gallbladder N5 disease. That will then find gallbladder within 5 words or less of disease, or disease near 5 words less of gallbladder. And there are other ways you can adapt the search too. But basically, the near operator allows you to search for terms regardless of the order you enter them, but within a specified word range. And for the EBSCOhost platform, whether it's classic or the new one, the number is literal. It is 5 words, or N5 will be 5 words or less. There are some platforms, for example, will have ADJ5. It means 4 words or less. Okay, so it is a literal number. Within finds the words if they are within a specified word range or less of one another, but in the order you enter them. So again, childhood obesity I've used there as an example. So childhood W8 obesity finds the term childhood within 8 words or less of obesity, but not vice versa. Okay, so again, you would have to determine which is the best precision operator to use there. Now, multiple terms can be used on either side of the operator. And if you're looking at flu or influenza vaccine, you could create a query in this way. So flu or influenza in parentheses near 3 words or less of vaccine. And now I've truncated vaccine also because it could be vaccine, vaccines, vaccinated, vaccinations, etc. So it could be influenza vaccine, or it could be vaccines for influenza, or vaccines for flu, or vaccinations for flu, etc. So again, we're just using these operators, these precision operators, for proximity searching to enhance the retrieval of what's out there, as it were. And again, these are also time saving because you're not having to enter multiple strings. So you could enter flu vaccine, influenza vaccine, etc., and so on. So with that in view, we are going to run through the search that I outlined in terms of the research questions. So we are going to go through this. For some, this may be quite tedious. I think most of you are used to this. There are much more extensive searches that we could run, but again, for the sake of demonstration, we'll just run this one today. So I am going to go to my desktop. You should see the advanced search page for the new EBSCO interface. Again, some of you may already be using this. Some of you have yet to migrate, but this is as it is. This is live. This is my demonstration site. And you can see here, I'm not going to all the features on this session. We cover it in other sessions, but you've got the 3 rows here, which is the tool advanced search page. This is the landing page I've got. Some of you may go to basic search, but for this kind of level searching, we want to really go to the advanced search page. We've got the drop downs here, again, including title abstract, which we'll use in a moment. And you can include the Boolean operators if you're entering line by line, by the way. And you can add up to 12 rows here. So if you prefer to enter your terms line by line, you can do that here as well. Okay. For those who are doing unqualified searches, as I mentioned, you've got the search options here. So this details how we're searching. So on my demonstration here, I've got proximity search. I don't think I've changed the background precision for that. You've got more information at EBSCO Connect, again, about these elements. And then expanders, I've got apply subjects on currently. Okay, so in the EBSCO Connect link is there for more information about the expanders. So again, these can all be enabled or they can all be disabled. Some of these can be hidden or all can be hidden if necessary. Likewise, with these search modes, they can be relabeled. They can be hidden as well if not applicable to your user. So again, you can consult your users, your colleagues, etc., as to what works best for your institution and the research they're carrying out, especially in support of systematic reviews. So we're going to begin then with the search. So we start off with looking at cancer patients. So what I'm going to do here is, again, try to incorporate some of the things I've shown you today already. So cancer, we're going to put in the asterisk. That would be cancer, cancer's cancerous. Likewise, oncology, we're going to do oncology here and truncate this, oncology. So that would be oncologic, oncologist, oncology, etc. And neoplasms are add just as it is. Okay, and I'm going to search for this within the context of title and abstract searching. So select from the drop down. Okay, so I can check my terms. Now, I may make mistakes, and you can let me know if I do, but there are ways to edit the search string in the search history if we make an initial mistake, because we can check the results. If there's a 0, then we can modify our search, etc. But you can see here now, I've got the search history started to display. So this is the new advanced search results page. So basically, it maintains the rows above, and it does display the search history above the results. So you can see here, I've got the XB search with the truncated terms combined with OR. It is still recording the search options. The search mode is proximity, apply subjects, but these will be overridden by the fact that I'm using the XB field code. So basically, it's giving me that information, although it's not necessary at this time. The results are there. You can see which database I'm searching, and I can report on that. And there's also the tools menu, which allows me to edit the search. If I wanted to add other terms, for example, I can. If I want to delete this string, if it brought back 0 and I mistyped it badly, I could delete and start again, as it were. So the next term we're looking at is, of course, the equivalent subject term. So for that, I'm going to go to the CINAHL headings, or I can either click New Search or CINAHL headings. So I click New Search here. and then go to CINAHL headings, and I'm going to enter my term here. So for example, I'm going to enter cancer, and just browse the thesaurus to see what equivalent terms there are there. So I click search here, and you see here it's brought up this list of index terms, and for cancer we should be using neoplasm. So I can click on this term to see more about that term. It gives me a scope note. It gives me the opportunity to select that term. Okay, when I do, it selects the term below it in the subject tree. So this is the CINAHL tree, neoplasms, and I've got the explode option there to include these other terms as well, and there may be others I want to include. You can also see there are related headings too that I want to include. I've got cancer fatigue here, cancer survivors, chemotherapy, cancer, oncology. So I'm going to include those subject headings too, they're related headings, so I can scroll down and see more here. So I'm going to add that there. And what I've just noticed also I didn't add in my search, which I can modify. So I'm going to still search this. In fact, let me just scroll down a moment. I might have something here that I can, so it's tumor. Yeah, I'm going to leave that as it is now. Just select these terms for now. And I'll click search. So I'm doing now the equivalent subject search for cancer. So I've got that there. You can see that in the search history, set 2 here. And so you can see the syntax, MH, it's the exact subheading. In CINAHL, it's the field code. It would be the equivalent in MEDLINE, by the way, MH. Plus sign indicates exploded to include other terms, and I've included some related terms. Now, one thing I just recorded, I didn't put tumor in my first set. So this is an example where you can change it here at this stage. So if I go to the tools menu and edit search details, I can add I can just add here. Actually, I can just modify. Actually, edit here. Click edit search, not the name, and it brings back this search box as it were, and I can add tumor. Okay, tumor. Okay, so if I wanted to again add, I can add the alternate spelling, so I can put the hash there as well, and then I can leave it as so. Okay, so I can update the search. Get the cross there. Close this down, and then we'll be brought back to, in a moment, the search view will be brought back to the search page. Okay, and it's not doing this for some reason. Okay, there you go. It's just a bit of a lag there. Okay, so now you can see the term there. Okay, so I've got the search string there. So I've modified this, and it's, refreshed it as it were. So what I can do now is combine those two terms. Okay, so this relates to the cancer element. So we're looking at adult cancer. Now with the adults, we're going to filter by adults later. So we won't factor that into the search right now, but we will also apply that. So I'm also going to make sure that I'm back on. So let me just change this, going back to the multiple data with selections and go back to CINAHL. Okay, so back on CINAHL again, specifically. So I'm now going to look at, that's interesting. So just delete this set. Okay. So just say, yeah, interesting. Think. Yeah. Okay. I'm just going to delete this set for now. Okay, because that was where it was running. It seemed to be running against multiple databases. But anyway, we're back on the track as it were. So I'll select these two and then combine with OR here. And when I combine with OR, it places the two sets in the top search box. So I can see that on the same page as the results list with the search history open as well. And I can click search here. Okay, so we got those results displayed. Okay, and I now want to look at fatigue, because obviously fatigue is a factor that we're looking at in terms of these adult patients, these cancer patients. So I'm going to start searching for terms here for fatigue. Again, I may use some truncation here initially. So let me do that now. So fatigue. You've got the autocomplete, by the way, which are features, and that's just giving you the popular searches from users across the globe. So you can use those terms. It may give you a clue to other terms, synonyms you may want to use, but you don't have to use those search strings necessarily. I'm going to add this. I'm going to make that lethargy can be lethargic as well, and then exhaustion, I can be exhaustive, etc. Or mostly also exhausted or exhaustion. So I can add that, and then tiredness could be tired or tiredness. Okay, so I could put tire or tiredness. Let's just truncate it there for now. And then I'm going to apply the XB field code as well here, and then run the search here. Okay. So that is another set. That is the title object search for fatigue. And of course, I'll do the equivalent for the CINAHL headings. So I can go back to CINAHL headings here. I'm just going to clear the screen here and then browse for, let's see, fatigue, essentially. Now, we did choose fatigue earlier, cancer fatigue. So again, that's something you might want to query later on and maybe incorporate into this aspect rather than the initial cancer element. But I've got fatigue here. So again, I can click fatigue here and I can select from this menu. Okay, and you'll see it selected below. I've got mental fatigue as well. I could include here as well. And let's see, can hide those. So if there's anything else I might want to include here. So maybe just for those for now. Okay, fatigue. Okay. So again, there's exertion here. Possibly could use a related heading, could use that one, and then add the search. And again, the search string is put in the top search box, and I can run the search here. So this is again, the heading, the subject search for fatigue, and I can then combine the two here. Okay, S4, S5 with OR, and then search. So what I'll do at this stage, because we're looking at adult cancer patients who are experiencing fatigue, I'll combine the cancer element with fatigue together. So that's S6, which we've just run, combined with S2. Okay, and then this time I combine them with and. So that's the criteria that these adults not only do they have cancer, they're experiencing fatigue. So it doesn't include those who do not have fatigue, as it were. Click search. So that's kind of the P element of the PICO search PICO framework, as it were. So then I want to go a step further. I want to move on to the actual intervention, which is meditation. So we're going to look at that. So I'm going to start off with, let's see, meditation, and I'm going to truncate that for meditate as well. We look at mindfulness as well. That could be an equivalent term or related treatment. So mindfulness, okay, or mindful. Let's go for mindful. Truncate that. Or breathing, or breathing, okay, or yoga. And we could also add or guided imagery, and we could put that in exact as an exact phrase, guided imagery. So that's in quotes there for the exact phrase. So again, truncation, quotation marks used for this search. And again, it's going to be XB, title abstract, and then search. So then, of course, we are going to look for the equivalent subject terms as well here. So we're going to go to, so it's CINAHL headings again, clear this field, this term, and then we'll look for meditation as a subject term within the CINAHL index. And of course, what I'm doing here, you do the equivalent in MEDLINE as well. Okay. So we've got meditation there, so we can select meditation here. And then below that, we've also got mindfulness here. We've got yoga also there as well. So again, and you can see here the suggestion for transcendental meditation, use meditation, meditations, use meditation, etc. So you've got those terms also included. So we can also include those. And we can go further. We can go into meditation to look at that again. And you might see other terms. For example, we've got guided imagery here, relaxation techniques. Okay, they're also included there. In fact, some of these are included, I think. Yeah. Okay. So again, guided imagery is also there as well under, yeah. So we can just select those terms for now, add to the search. Okay, and again, each time you can see the headings that we've got selected, and the plus sign indicates there are additional terms that are also selected so for mindfulness, relaxation techniques, etc. And then we click search here. So again, this adds to the search history, so which is now displayed below the search boxes above the result list. So we can combine our terms, S8, S9. And by the way, although I'm looking at this in reverse chronological order, you can resort the search in the chronological order, the order you entered the terms. So we'll do that in a moment. So I can now look at these two terms, okay, and combine them together with OR, the Boolean OR. You can see the two sets are combined in the top search box. Click search. Okay, so that's the intervention. And then we want to move on to, in this case, the actual outcome, which is the quality of life. So obviously we're saying that standard care by implication is going to be mentioned when we look at these articles about meditation, yoga, etc. So we're not searching directly for standard care, but we will look at the outcome, which is quality of life. So we're going to do that now. So we're going to, again, same approach. I'll put quality of life in quotation marks. I can add or QOL, the acronym. In fact, let me just do this. In fact, I'm going to put this N1, near 1 or less of life. So it could be life quality, or it could be quality of life. So I've got that there with the near operator included there. I've got QOL. I've also got well-being as one word, or I can add it like so. Again, quotation marks, well, N1, being. So that's being well or well-being. Okay, so I'm using the near operator here, and I've got living quality. So again, it could be living quality or quality of living. So I could, again, put this one living N1 quality. Okay. Now you could debate about the numbers, but that'll be one word or less essentially. So it'll be words, just one word between the two. Okay, so that will be using the XB again. So again, any comments, questions on any elements of this searching, please do let me know. And again, if you do spot errors, if you do have second thoughts about how you reword these phrases, then you can always go in and edit the search. As you can see here, you got edit search details. Okay, you go in, edit search. So it's just a bit of a delay there. So go check if there's any other questions at this stage. Any comments? And then you can modify this if you need to. Okay. So, I mean, you could add lifestyle, I suppose, or lifestyle. Just as an example, I should put that in quickly just for now. Okay. And update the search. Continue. Okay. And then close this down. And then that will be amended in the search history. Okay. And again, I think I might have switched. Let's try and make sure I have to get out of this to make sure I'm still in the same database, just one database. Okay. So you can see it's modified this somewhat, but what I might do is just delete this string. So I had to change back to CINAHL. But you can see it's very straightforward to editing search strings to remove them. And when you do delete a search string, it will also renumber the set numbers. There's no danger of going from S9 to 11. It will preserve, it will just resort the numbering for the search strings. Okay, and then the final thing we'll do here, so conscious of time, is go back to the CINAHL headings, of course, and then I will just clear this, and I'll look for quality of life as an index term within CINAHL. And you can see that there. I can click on it again to see the scope note. I can choose it. You can see any related headings, which I won't choose, cost of living in this context. If I scroll down, you see the subject tree, and you see quality of life appears here, and maybe some other elements here I want to consider using. I think at this stage I won't. So it just shows you, it repeats it, by the way, because it just shows you in different elements, different areas of the subject tree. So it's under this section here, humanities, plus it's also featuring under anthropology, education, etc. as well. So I can add that to the search, as it were, and then click search. And I can then combine the two together. So S11, S12, S11 with or, click search. Okay. Now, for the purpose of combining those elements, and there are actually 3 elements essentially, or 4, I think, and then, we'll see. We can then resort this. So if you go to the ID option above the set number, then this will resort, and you can see where we started from, cancer combined with or, then fatigue, and then we combine the first 2 sets relating to cancer and fatigue together in S7. So I want to include this. We've then looked at the intervention meditation related terms, both in the title abstract and the subject area field, and then finally the quality of life. So essentially we've got 3 elements we're combining. So we use the PICO framework. We're actually searching for the 3 elements, plus of course adults. We'll add that or filter that in a moment. So I've got those 3 elements, and then I will combine them with and Okay, and you can see the search string appearing in the top search box, and then search here. Okay, now this would be the first iteration. I've done a number of iterations of this search. I keep changing it, so I might end up with more or less results, a few or less than I had before, but that's okay. So I've got 282 records at this stage. Now, I have run it again before and applied different things, but one thing I will do here now, before we look at the results, is apply the adult filter, as it were. So to do that, if I go to all filters here, I can choose, if I scroll down, the age group. So again, this will be equivalent in MEDLINE. They do have age and gender filters and more as well available. So I'm going to choose all adults here and apply it here. Okay, so 136 records. Okay, now also to point out here, and we might want to narrow it down to a time frame. So for example, we've got all time, past 12 months, 5 years, or 10 years. If we go for the last 10 years, that will also be factored into our search results. So not a huge number at this stage, but again, this could be the first iteration and we'll modify it later. But really, it's to show you the principles for searching, also to highlight the new functionality of the new interface with the search history displayed. That can be hidden, by the way. So if you want to focus on the search results at this stage, you can, but it is displayed above. Okay. And you'll notice also, so just to go through this again, you have the set number, okay, displayed, S1, S2, and so on. You have the search string with the relevant field codes, the use of truncation, etc., proximity operators, and so on, wildcards, MH indicating these are exact subject terms, and so on. Search options are listed, although we've used the title abstract searching, but in that same column under search options, you'll note it does track and record the filters that we've applied. So all adults and the past 10 years. So they are recorded here for reference. We have the set number. We have the options to edit the search or view which database we're searching on, which is obviously clearly given. And then you have the option to edit search details. Add to project simply means you just save it to a personal folder project. That might not be relevant at this stage, and then delete. But we will talk about saving, adding to projects in the next session, part 2, if you signed up for that one. So we've got the results below. Again, there are more filters that you can apply here. As you see, English language, peer-reviewed, and so on. So there are more that you could apply if necessary. And any filters you have applied already are already listed, as is the expander highlighted. But again, we've not been making use of this because we've been focusing more on title abstract searching, as it were. Okay. So I'm not going to get into the actual processing of records that we covered in the next session. Okay, so Claire's point out here a question. Some of our researchers have found that total numbers of results seem to have dropped in the new version of CINAHL. Is this due to new ways the articles are indexed, or is data still being loaded on the database? There is something about that. I need to follow that up with you. It could be a combination of both, but I need to verify that with my colleagues. Okay, Claire, so I appreciate that. Yeah, okay. Obviously, more content gets added. Sometimes journals get removed, others are added as well. So that would have an impact also. So again, we're also in constant negotiations with publishers to ensure we provide the best content available to users. So again, that may change with additional titles added and earlier ones perhaps removed. But again, I can't verify that right now at this stage. Okay. Okay, so Sally's asked a question. Is a custom option still on roadmap for the date drop down under search boxes? Yes, it is. So again, just to highlight that Sally brought up, I said the past 10 years, there is a custom option, and so there will be a custom option given in this area at some point soon. Okay, so that is coming. At the moment, if you go to all filters, you can customize the date range, okay, here. But the additional enhancement will be to allow you just to put a year in there, not a date specifically. So from here, you actually select a specific date, for example, 1st of October. Okay. So again, you have to specify a particular date, but for the two things then, first of all, you will have a custom range option from this drop-down menu. And secondly, under all filters, when you go to publication date, you will be able to select custom range and just enter a year. Okay. Yeah, good. Yeah. Okay, question also from Susan. Who should we contact, or how do we switch on the search history to make it visible while you search? So I would speak to your account representative at EBSCO, whoever that might be. So it could be one of your the account executive or account manager, to let them know. Okay, I think at the moment that's the process for that. Okay, so just if you don't know who your account executive is, if you're unsure, please let us know. I'll leave you my email address at the end as well. But it's just a process of enabling the feature in EBSCO Experience Manager. So the first step is to make the advanced search page your default landing page, and secondly, to make the advanced search result list the default page, which means you will see the search history. Okay, not every institution will need this. A lot of you will, because of the nature of the searching that you do and your users do. So again, that is something which will be enabled, but it is live, it is available. I know the NHS in England have it switched on by default now, and I think other NHS organisations are going in that direction as well. So if you're part of a consortia, it may already be enabled for you. But if you're outside that, you have your own setup, administration, then that's something which would need to be enabled. Okay, so it wasn't forced or rolled out for everyone. It was left to the choice of the accounts, basically your choice whether you want to see that or not. But it is available, and you see there. So let me see. I'm just going to think about. I don't want to show too much because we are going to cover more in the other session. So basically, I want to focus on the searching aspect. Essentially, again, introduce the search history. And you can build up an extensive search on here. You can I'll probably revisit this in part 2, but just to let you know, you can download up to 500 lines here. So you can see here, now it groups it as a search here, but it will include all the subqueries as well. And you can save it in a choice of formats: PDF, Word, CSV. So if you want a more of a table, spreadsheet look at the search history, that's possible. XML, RTF, and text format as well. So you can download the search from here. In fact, let me just do that now so you can at least see it. I might cover this again in the next session. I'm going to have to save the file. And then I'll just go in and access it from now I saved it as a PDF, but you can see here, this is the search. Okay, so it gives me the query, the set number of the query, it's date stamped, the set numbers, search mode, expander if applicable, the interface, and the database. All those are listed, and you can see the set numbers there reflected on each of these pages of this PDF document. So you can do the same for Word, RTF, and also if you use the spreadsheet format. So again, you see the query there. Okay, so even it gives you the sets combined, it also gives you the actual expanded query there as well. Okay, so again, for reporting purposes and so on. So that is available. Okay, so I think what I might do now is just go back to my PowerPoint. About 5 minutes or so. I know we started a little late, but let me just stop here. I don't think I need to look at anything particularly here at this stage. Again, some of the tools that we'll explore in more detail when we're processing results. So I won't get into too much detail today. I will say though, on the left-hand column, before we leave this page, you have got, and by the way, recent activity also includes the search history. So you can see here, it's been recorded here as well. And you can resort using oldest. So at the moment, all of you, if you have access to the new interface, you will see this information. This is available without being enabled. It's already there. And you can see here, you can also download the search from here as well. Okay, and you can delete if you need to as well. But this gives you the same search history displayed in this format: date, numbers, etc. The application of search mode expander if possible, and then if you scroll down further and load the rest, you will also see the inclusion of the filters as well with the resultant set of numbers. So it does give you the set here as well. Okay, but obviously we've introduced the advanced search results list as it's based on user feedback and what was there before in EBSCO's classic. Okay, so those are there as well. But I want to highlight the help menu on the left under research tools. Now this will vary probably for institution, because some, like NHS England, they have the new discovery service on the same platform. So they are directing users to their own help screen, as it were, own help website. So again, by default, it will come to this page, which is the quick start guide for new EBSCOhost. So if you're very new to this and have not yet migrated, or even if you have, it's a really useful source because it covers the basics of searching and browsing, applying filters, reading an article, etc., searching with Boolean operators, wildcards. So I mentioned that earlier, and you can see more examples there of using the syntax, etc., a bit more in depth there. And also it does give you also the database help files as well. So if you want more information on qualified searching, if you go to that page, then it will give you the option to choose the appropriate version of database. So I use CINAHL, the basic abstract in its only version, but you also got these others here. Now, I'm also conscious there's one other thing I didn't show you, and I will go back to that quickly. So let me just go back here. We did have the filters to show you too, so I will go back to the PowerPoint. Before I go any further with the help menu, I wanted to also highlight the methodological filters, which you did say we would cover. So just to recap then, this is a copy of the search history that I ran earlier, and it's got the various elements, the PICO elements, so primarily the patient, problem patient population, the intervention, and then also the outcome. So again, and then combine the sets all together. And we do have these help sheets available for CINAHL and MEDLINE, so whichever database you're using, or both. And it also features XB field code now. So it gives you, these have been updated recently, and it basically gives you the syntax that you should be using when you're searching the EBSCOhost platform for either of these databases. So the use of subject headings, title abstract again, field searching, other field codes, etc. Okay, use of syntax and so on. So those are available on EBSCO Connect. In terms of methodological search filters, just quickly then, some of you would have seen this previously. Evidence-based practice, there's a tick box that you can use, and that will filter results to articles from evidence-based practice journals, articles about evidence-based practice, research articles, which include systematic reviews, clinical trials, meta-analysis, as well as commentaries on research studies. There is an equivalent one, slightly different. So there is an EBM reviews filter, evidence-based medicine reviews filter, and it will limit search results to the following 6 titles. So Cochrane Database, ACB Journal Club, Clinical Evidence, and so on. So it can be applied to results to your search. So basically you can run the search and then select this and retrieve records that are filtered according to that criteria, etc. Okay, and just going to comment here on James's question earlier. As a library team, we are considering whether we need to create a new suite of in-house videos on searching. Is EBSCO happy for us to use EBSCO slides and video content if relevant? Okay, you can get a lot of information from the EBSCO Connect portal. I'll just show that at the end. So there's information there that is publicly available. So that shouldn't be a problem if you need, because you can download the PowerPoints that are there as well. So again, you just may want to attribute them, but I don't see that as a problem with what we've publicly displayed through the tutorials, etc. Okay, but we can talk offline more about that further if necessary. Now there are clinical queries filters as well. So both CINAHL and MEDLINE have clinical queries. For CINAHL, there are 5 research areas covered. So you see therapy, prognosis, review, qualitative research, etiology. Okay, so the screenshot there is the menu, the drop-down menu, where you can select the appropriate research area. And for each of these research areas, there are these 3 strategies. So you can be looking at the high sensitivity for therapy, for example. That is the broadest search to include all relevant material, although it may include less relevant content. High specificity is the most targeted search. That will include only the most relevant results set, but of course may miss other relevant content. And if you're like me, you're cautious, you might want to go for best balance. Okay, so for each of those 5 research areas, as a single clinical query, it does give these 3 choices, as it were. And we do have a FAQ on that. Now, just give an example of what they look like. So we have the search strategies also available in EBSCO Connect. So for therapy or high sensitivity, you can see the search string, the combination of terms, the Boolean terms, the exclusion of certain designs, use of TI or AB for title abstract searching, and so on. So you can see there is a methodology behind each of these filters, and that's clearly specified within the examples here. And these examples are available through the FAQ on what are the search strategies used by CINAHL clinical queries. So they're available via EBSCO Connect. So just give you an illustration of what search strings are behind these particular menus, as it were. Then you have MEDLINE, has 9 research areas. It also includes costs and economics, as well as diagnosis and clinical prediction guides. Again, you have the corresponding menu within the database with the 3 strategies that are also covered. And to give you another example, this is one for diagnosis. You see the high sensitivity search strategy compared to high specificity, which is simply title or abstract searching. And then you have the best balance between the 2, okay, with more information available on EBSCO Connect. Okay, so I probably have time to go through that as an example. So what I might do is just clarify that. So I actually might just quickly go back. Actually, let me just do that quickly while I'm on the screen here. I will just do a quick search and then we'll wrap up, I think. And then I'm going to switch databases here. So I'm going to go to MEDLINE this time. So let me just deselect. And I'm just going to do a quick search here. So I'm going to put in colorectal cancer. I know just for the sake of time, I'll select the terms from the drop down. I'll combine that with screening or early detection, etc. And so I've got these two search strings here. So this is more like a scoping. It's not anything detailed so much, but just to illustrate, you've got EBM reviews here. I can select this filter, click search, and it's giving me, okay, I need 24 records, and you can see them appear in the search history as well, which I'll hide. But the key thing here, you can also see, obviously the quality Cochrane database, evidence report, technology assessment. So again, if you want to see the actual publications where the content is originating from, then go to all filters, and you can even filter by publication. Okay, so you can see we have 13 references from the Cochrane, 5 evidence-based nursing, evidence report, ACP Journal Club, etc. So again, these are the titles that EBM Reviews is filtering according to that option, right? So if you want to look at the evidence-based nursing content, then you can apply that filter and just view those 5 references, okay, in relation to this topic. So you have that, and just to clarify, I won't actually apply this now, but if you go to the filters, you'll see we've got clinical queries here. Okay, so again, the 9 research areas with the 3 strategies, okay, included. And if you jump back to CINAHL, you'll find the same filter or the equivalent spot for that filter under filters within CINAHL. Again, these are the 5 areas that are covered within CINAHL. Okay, so you just create the search above and apply that to that search. I'm going back to my PowerPoint here. So just a brief demo there of the filters there. Just to highlight that, obviously no doubt many of you are familiar with Prisma and the checklist. So just want to verify that obviously with a search like this, we are looking at, being able to specify the databases that you use, the reference lists and other sources search. Again, that's spelled out in the Prisma checklist, so you can do that. And also to be able to present the full text search strategies for all databases, etc. Okay, including any filters and limits used as well. So there is an ongoing effort at EBSCO to support those workflows in terms of CINAHL reviews. So this is a good page to keep up to date with because it does outline recent changes to the interface with that in view, plus it gives you what's coming soon. So I know it was mentioned earlier about the custom date range, and that's earmarked for enhancement in due course. So that's a good page to go to. Also included the link in the PowerPoint there. So again, you may want to refer to that. And so just to clarify then, obviously use PICO to alternative frameworks that others out there to construct search strategies in support of CINAHL review. Combination of free text keyword searching, whether it's unqualified or using the title abstract option, and the relevant subject headings, whether it's the CINAHL headings or mesh terms, if you use MEDLINE primarily. Use, of course, the EBSCO syntax. So we've gone through that today in our help sheets detailing that. And also, we'll talk more about creating a personal MyEBSCO account later to save searches. I didn't get into that today. Probably should have covered that, but I will maybe revisit that in the next session. Okay, so I did talk about downloading the search itself. But perhaps we'll cover this in the next session, okay, because of time. And then also consider using the methodological filters when available to identify key articles to give clues for search terms. So again, that might be an initial starting point to see what's out there, what's been done before, what CINAHL reviews, meta-analyses that are already out there. Again, that can be in support of someone or a team doing a CINAHL review, also your part in that as well. So we do have training support. Again, I've included some key links there for some that might be helpful with some of the questions you might have after the session as well. So you'll have those to refer to in the PowerPoint. And also you'll be able to consult EBSCO Connect, connect.ebsco.com. And for those who are looking to join future sessions, including part 2, we have the Stacks Discovery Portal, the Training Resources Portal, which gives you details of upcoming training sessions, including part 2 for this session. Okay, so I will say thank you for your time today, but you can contact me directly at rcrooks@ebsco.com or contact your local EBSCO account team for more information, particularly if you're in the process of migration and you want to switch on the search history, then please reach out to EBSCO about that. And obviously any feedback's welcome. We are going to be obviously enhancing these sessions with more information as things develop further. And we look forward to seeing you on part 2 in due course. Okay, thank you very much.